Welcome, I'm Diane Marie Collins, and I'm here today with Dr. Alan Goldman, the Medical Director for iTech Medical. Welcome, Dr. Goldman.
Thank you.
Now, you've obviously had a lot of experience with the MPR technology. What other areas are you leaning and moving into?
It's a type of technology that can really be applied to any other body part. We have looked at possible carpal tunnel, we've looked at the knees, the shoulders, the elbows. You can put the sensors on any part of the body and you're just reading the contractions. It's basically a matter of just building up a normal database to compare it. With the back in itself, there are a great number of abnormalities, fibromyalgia, scoliosis, actual disc herniations, what are called facet syndromes, where the bones of the spine come together. These are other issues or other causes for pain, and as a clinician, as a researcher, I want to study a lot of those things to see what are the patterns, because we may be able to find a new way to diagnose some of these other disorders.
Dr. Goldman, how do you plan on introducing MPR into the healthcare system?
Well, right now, on an almost everyday basis, we are testing subjects. And we have plans, when we're done with this phase of our testing, to open it up to other centers in other states. I will be writing all this information up, publishing it in the medical journals. We have a very strong medical advisory board that I work with, 4 gentlemen that are leaders in the field of spine. They're chairmen of departments at various universities. At the medical meetings and again in the medical journals, we will be talking it all up. And again, also just word of mouth. We've had tremendous enrollment for this study, and obviously the folks that we test go back and talk to other folks, and sooner or later it's heard by the other doctors. And in the community, we seem to start to be getting to know. So it'll be through medical colleagues, medical meetings, and publications.
Well, you're obviously excited about MPR and iTech Medical. What do some of your other medical colleagues and professors think about the system?
We've had remarkable feedback. Everyone is very excited about it because it seems to be an innovative breakthrough type of technology where there needs to be that type of technology. It's another tool in the toolbox of diagnosing that we've never had before. So I've been really thrilled with the reports back and the discussions with my colleagues. And once they see the technology and once they've had some of their patients undergo the testing, as we did in California and now in Utah, the word is very positive, very strong. It's very, very gratifying.
Dr. Goldman, I know as a physician you take an oath. What does that mean in regards to this project?
Well, it's the Hippocratic oath that every medical student takes when they graduate. And it basically says, do no harm first. As a professor at these various universities, I would retake that oath every year at graduation because it was very meaningful and still is very meaningful for me. And I think that MPR technology really fits into my desire as a physician to treat and to help people. So I'm very gratified that I'm involved in something that satisfies my inner need as a doctor.
That's really wonderful. Thank you very much.
Thank you.
We've been visiting today with Dr. Alan Goldman, Medical Director for iTech Medical, discussing MPR technology. Thank you.
Thank you, Deanne.